Hey folks, welcome back to the Transplant Again today. My name is Jim Merle, and today we're going to be answering basically 3 questions in one. So you're kind of getting a bonus right out of the gate today, in that I am going to be answering 3 questions kind of wrapped up in one today. So this is kind of a special episode. With that being said, I was actually asked this question back a couple to 3 weeks ago by a great friend of the program, someone who is currently awaiting a heart transplant. But they basically asked, Jim, what are the most important questions you can ask both pre, during, and post-transplant? So that's where I get at my 3. Pre, during, and post-transplant. What are the most important questions you can ask? And I had to think this one through a little bit. It was kind of a head scratcher for a little bit. And I'll be honest with you, if I'd answered this 2 years ago, it may be different. 2 years from now, it may even be different from that. But at least currently today, I'm going to answer it in this way. When we're considering pre-transplant, so question 1, the most important question you can ask then is basically this: is this the only way? Is this the only way? Now, as a disclaimer, I'm not implying that any transplant center is trying to rush anyone into transplant. I don't believe that for a moment. They're very professional in their evaluations. They're very good at what they do, and they know when the time is right. However, there are some cases, like mine, for example, where we're talking about transplant. That seems to be the only way, quote unquote, they're giving you. But when you really talk that through, it turns out there are a few small options that can come before that ultimate transplant. For example, I was actually evaluated 4 times pre-transplant before it was ever determined that I was ready and qualified to be transplanted. And the first 3 of those times were pretty difficult. Basically every time, even though I didn't feel good, wasn't doing very good on any of the testing, the doctors were coming in and discussing with me whether or not it was the time to transplant or be listed for transplant, or if I could wait another 6 months and be evaluated again. And for 3 of those times, that was exactly the decision they made. Up until the point, even that 3rd time, 2 of the doctors, now granted they already had quote unquote a decision day meeting prior to me getting there in clinic, but they had sat down and talked about it, but they got outside of my door and nearly came to blows with one another, arguing, yelling at each other as to whether or not it was time to list me or could we wait another 6 months. That was the argument outside my door. That's kind of scary to think that they haven't even made a decision yet, but that's where we were. Now, eventually I was listed. Of course, here we are 11 and a half years post. I'm thankful for my blessing, but always ask that question, is this the only way? Because in asking that question, you more or less give yourself a 2nd, 3rd, 4th, 5th, or even 6th opinion, if you will, because it just makes the doctors and the clinicians step back and consider, is this the only way? Are there other procedures? Are there other medications that can be given? Are there other options available that we can use prior to transplant? In my case, there were some options. That's why I was able to live out 6 years prior to actually being listed from the time they said or associated my name with transplant. So I ask that question every time. Now, as far as during the process, question number 2, during the process, I would always ask this question: what is next? Okay, what is next? Now, I say during the process, I'm kind of boxing that in between being listed right here and being transplanted. For me, that was 10 months later, okay? But as I was in and out of the hospital many, many times, or in and out of clinic many, many times, I always asked those doctors when they came in the room, what's next? Because what I learned, particularly being inpatient sometimes, when they're making their rounds in the morning or the evening or vice versa, or both, they would oftentimes come into your room very quickly, basically take some vitals and ask you a few questions, and they would dart out the door if given the opportunity. But by asking them every single time they came in the room, what's next, that made them stop, reevaluate, and consider, and have an answer prepared for me. Eventually, they learned the hard way that I was going to ask that type of question. And that kind of gives you, again, that buffer of understanding. And there's so much comfort that comes in the knowledge of just kind of knowing that next step. Where are we at? Where are we going? That sort of thing. That was so very important. So I would ask that question during the process between being listed and transplanted: what's next? You need to be well informed. You need to be well advised. And that's the way you can accomplish that. Now, as far as the 3rd question, we've got pre, we've got during. Now, what about post-transplant? What are the most important questions that can be asked then? Well, these questions I would point towards self, okay? You look in the mirror, answer these questions for yourself. And it's basically one question asked 2 different ways. But the first half of that question is, where have I been? Okay, where have I been? Second half, where am I going? Okay, where where have I been and where am I going? You ask this question constantly of yourself, and I still do today, even again, 11 and a half years post, where have I been and where have I going? Because some days you're just going to have bad days, particularly shortly after transplant, the first month, 2, 3 months or so out of transplant. You're going to have up times and down times, highs and lows, difficult days and great days. And if you're constantly asking that question, where have I been and where am I going? You're basically kind of resetting yourself, okay? Because it's too easy, very, very easy to get frustrated, especially on one of those really down days when you say to yourself, you know what, this just wasn't worth it. I don't know why I went through the whole process, why I even bothered with transplant. I'm not doing what I wanted to do. I'm not having the success I hope to have. And you can get very frustrated. But I promise you, in most cases, 99.9% of cases, if you'll ask yourself, where have I been? You're probably going to be able to say, okay, I've been worse. Okay. I've had worser. And that's my word. Worser is a real word here in the South. At least for me, it is. I've had worser days in the past. And so today may not be that great, but it's better than the other day was. It's better than 2 years ago was, or whatever, however far back you have to go to measure that and find a day when things were worse. And then you'll notice things seem better where you are. Now, heaven forbid it be the case. But if you think about that and ask that question, you know, what about yesterday or where have I been? If you say, well, I've never been this bad, then answer the other question, where am I going? Okay. Set yourself a goal. And I continually try to motivate myself by looking in the mirror daily and setting myself a goal. Now, when I set goals for myself, I try not to set those goals way up here, so far out of reach, I can't obtain them. Okay. That's just going to get frustrating every time. I like to set goals, as I like to call them, just right above my head. Just kind of rub the top of your head. That's where your tomorrow goal needs to be. Okay. When you wake up tomorrow, you reach for a goal that's right there. That's obtainable. That's gettable, if you will. And that will help to motivate you. Okay. So if you want to answer questions for yourself after transplant, post-transplant, where have I been? Where am I going? Those are the most important questions you can answer for yourself. Try to answer honestly and sincerely, but I promise you that will be a motivator to you. So again, to remind you of those questions, pre, during, and post. Pre, is this the only way? During, what's next? And post, where have I been and where am I going? I promise you that'll be a huge motivator to you. Okay. Thank you so much for joining me today on the Transplant Helper. And until next time, please stay stronger, my friends.